Welcome to lesson 2 of the Anger Management Facilitator training. My name is Desiree Cochran-Norfolk, and we are going to be talking about core knowledge review. So in this session, we're going to explore the essential foundations that every anger management facilitator must understand. And that's going to be how anger develops, what maintains it, and which approaches are most effective in addressing it. And by mastering this knowledge, facilitators are going to be able to guide clients with accuracy and empathy and skill. We know that anger is a natural human emotion, and it's neither good nor bad in and of itself. The key is how we express it and how we manage it. Because anger can serve very constructive purposes, like it's going to signal injustice or motivate change. But when we express it destructively, it can lead to violence and it can damage some of our relationships and lead to legal consequences. So as facilitators, our role is to help clients recognize anger as a signal, not a solution. Because anger usually follows a predictable cycle. So the trigger is going to lead to the thought, which is going to fuel those strong emotions. And that's going to result in behaviors that lead to consequences. And I'm constantly telling my clients, what you think influences how you feel, and how you feel influences how you behave. And the clients are only focusing only on the behavior. But the real work lies in identifying the earlier stages, especially that distorted thinking. So teaching our clients to interrupt that cycle before it escalates is one of the most powerful skills that we can give them. And we know that the triggers are going to vary from person to person and culture to culture, but the common themes are going to come up. So a lot of our clients are triggered by feelings of disrespect or rejection or loss of control. And it could even be like physical pain or stress or even hunger is going to lower their tolerance, and that's going to fuel their anger. And some people, for substance use or like withdrawal, is going to increase their irritability. So by exploring what these triggers are, the facilitator is going to help the client identify the patterns and really plan some healthy coping responses. So again, these thoughts are playing a central role in how the anger is developing. And so if we go back to cognitive behavioral therapy and the cognitive distortions, or what we call thinking errors, those magnify the situations. So for example, assuming someone cut you off on purpose, or believing that nobody respects me, that's going to fuel the unnecessary anger. So helping the clients recognize and challenge these distortions is going to allow them to regulate their emotions and respond more rationally. So here on the screen, I have all or nothing thinking, mind reading, assumptions, overgeneralization, or catastrophizing. This is just a small subset of those cognitive distortions. So anger, the emotion, is going to activate our body's fight or flight system. And that's going to release adrenaline, and it's going to increase our heart rate. And so the clients are going to experience tense muscles and flushed skin, maybe even rapid breathing. They're going to feel hot, maybe tingly in their hands or feet. They may feel lightheaded. And these physiological changes are preparing the body for action, but it's going to reduce the ability for them to think clearly. So teaching the clients to recognize these body cues helps them to apply calming techniques early on as they're noticing these, instead of waiting until they reach a 10 on the anger meter and now they are going to jail. Unmanaged anger is going to have a serious consequence for these clients once they reach a 10. So beyond straining their relationships, the anger is going to result in legal problems or losing their job or probation requirements or broken things in their household or someone else's household. So on a physical level, chronic anger is going to increase the client's risk for heart disease and some other health conditions. So by drawing the connections between poor anger management and real life outcomes, the facilitators can motivate clients to commit to the change. So when we are running an anger management program, for it to be effective, we have to rely on evidence-based practices. Cognitive behavioral therapy is the most widely used, and that's going to teach clients to recognize and reframe those distorted thoughts. Stress inoculation helps the clients prepare for difficult situations. Communication training is going to reduce conflict. And then the mindfulness and the relaxation techniques are going to address the physiological arousal and helps them to calm their bodies down. And so as facilitators, we should integrate multiple approaches to meet our clients' needs. And by the end of a structured program, the client should be able to identify their personal triggers and recognize what those early warning signs are for them, and then be able to apply some coping strategies that they have learned. And they should also learn to communicate assertively. And that means just expressing their needs without the aggression. And we also want to teach them to replace those negative, distorted thinking with the healthier alternatives. And these core skills are going to create a lasting change when they are practiced consistently. So let's look at a case example here. The client feels disrespected by a supervisor, and his thought pattern is, they're always targeting me. So he's going to react by shouting and storming out, and that's going to result in a formal write-up. So in group, we help the clients to analyze this cycle and identify the distorted thinking and explore some alternative responses like calming strategies or assertive communication using I statements, things like that. So as a facilitator, we have to ensure that our clients understand all of these concepts, not just hear them. And that means simplifying the language. And we have to use relatable examples. And we also have to model calm responses. I've had many clients who have tried me in these classes, and you have to remain calm and model how you should respond to someone when they are getting aggressive. We also need to provide constructive feedback during role plays and also encourage real world practice, and that's going to reinforce the learning. So I like to give homework to the clients, and they are always on the lookout for anything that triggers their anger, and they are going to report that back at the beginning of their next group of what triggered it, what were the cues, the physiological cues that they noticed, and how they calmed themselves down. And they're going to be practicing these things, and I'm going to give them an anger control plan. And so each week they're writing a new skill, and they're required to carry that around with them. So if we are consistent as facilitators and we have patience, that's going to be the key to helping these clients internalize these skills. So in summary, we've kind of reviewed the building blocks of anger management, and we've examined anger as a natural emotion, the anger cycle, the common triggers, the thinking errors, the physiological responses, and also the consequences of unmanaged anger. And we also introduced evidence-based interventions and key client skills. And these foundations prepare facilitators for applying strategies. So let's wrap up with the reflection. I want you to think about your own clients. What triggers come up most often? Which distorted thoughts are driving their anger? And how would you explain the anger cycle in just a simple, non-clinical terms? Practicing how you present these concepts now is going to make you more confident and effective in real situations when you're doing sessions. So put your answers to these questions in the comment section below.